Hey, it's Dr. Bill with just the tip of urology school and just the tip of erectile dysfunction. Wow, that sounds weird. There's some interesting things going on with sexual health that happens to be my area of expertise and interest. And because of that, we're going to put this podcast on not just the Tip America, but our sexual healing podcast. I think that certainly this is going to be geared towards physicians, nurse practitioners, physician assistants, and medical students as well as residents who do have an interest in this field, but also I think it would be of interest to turn on the general population to these concepts because we certainly need their buy-in to work with us when we try to tackle this issue. As always, this is just an overview. I welcome your comments as well as questions that may come up, and there are a variety of ways of getting a hold of me and my team through our podcasts. Also, it's understand that we use the American Urologic Association guidelines as well as core curriculum to address this. And it's just not urologic issues. We're going to find that there are a whole bunch of other things that are involved in sexual health. It's of interest for people to treat who are comfortable in thinking out of the box. And though we're going to talk about erectile dysfunction as relates to men, certainly female sexual dysfunction is important part of what we should be doing every day in listening to our patients. And women certainly deserve a separate podcast for this, and this is forthcoming. A lot of the concepts, a lot of the thinking on how we approach sexual function does impact both genders. So when we're talking about sexual health management in urology, it's important to understand that we still have to think in terms of other subspecialties. Though we think about hormonal issues, vascular issues, psychosocial issues, and neurologic issues is really the four mainstays of what we do. There's a whole host of other factors that impact good sexual health. And how do we define that? It's really defining good sexual health as our patients and partners define it. There, we leave our biases at the door. If you come away from this podcast with any other message, please remember to leave your biases at the door. Good sexual health is something that is up to a comfort level for both patient, partner, and legal, obviously. And we want to make sure that we're not hurting anyone or coercing anyone when they expand their sexual menu. Expanding their sexual menu can include places and time for for interaction, for sexual activity, sex toys, role playing, a number of different things, as long as no one feels uncomfortable in that situation. So understand that aside from the big four that I talked about, general health is certainly a big issue. Diet, exercise programs, psychological health, the relationship, the quality and level of communication with both patient and partner. And this is parenthetically, sexual health may be just for some people, just unpartnered sex, self-stimulation, masturbation, and fantasy. And that is okay as well as they are comfortable, as long as they are comfortable with it. Cardiovascular management. We know that the vessels in the penis, the vessels in the clitoris are very, very small relative to the vessels in the heart or the carotid vessels to the brain or the vessels that feed the kidneys. So if there's kidney dysfunction or evidence of cerebral vascular accidents or certainly cardiac disease, ischemia in relatively big vessels, we got to believe that the smaller vessels are going to be impacted as well. There is data to indicate that you take a healthy 50-year-old guy without any evidence of disease that presents to the doctor, whether it's primary care or urologist, with concerns of sexual dysfunction that is related to a vascular problem, that they're at risk for a heart attack or stroke by about 5 years in the future. So there actually has been litigation where primary care physicians and urologists have just focused on the sexual function issue and not have predicted the potential of cardiovascular disease and sending those healthy patients for cardiovascular management. So read these guidelines, read about metabolic syndrome, read about hormonal management, diet, exercise. And when you think of diet and exercise and belly fat reduction, that is a big, big deal. But what also is a big deal is penile rehab. Ask about morning erections. Morning erections give a good indication of what your cardiovascular health is, as well as what your hormonal health is. So be aware of that. Also understand that a lot of people put all this crazy emotion behind sex. And beyond the emotion and the couple's relationship issues, sex is what? It's an exercise. So you got to prepare for that exercise. If you're going to run a marathon, you can't decide that tomorrow you're going to enter some huge race. You got to build up to it. And so for those patients who don't experience good morning erection, they're losing that aspect of exercise and dilating the vessels, bringing in blood flow and bringing in good oxygenation. And so we use things like penile pumps or vacuum tumescence devices. It's not crazy. It's not porn. It's not to have sex with necessarily. Basically, it is a piece of exercise equipment that usually in most public gyms you don't have. So you want to buy that and get them for $25 over the internet, a handheld pump. There are a variety of number of my podcasts and social media information that offers direction on how to use them, when to use them, and how to use them in conjunction with other modalities like PDE5 inhibitors like Viagra, Levitra, or Cialis. So they're really a fascinating group of things that we think of when we want to tackle sexual health. So think of it as an algorithm. You're not doing it alone. You can try to do it alone, but sometimes unless you have a staff like mine or a team like mine who are really geared up for that, it can be overwhelming. So use that algorithm to decide when you bring in other people, and you are the center of that algorithm. You're the one who's checking in periodically to make sure that things are moving in a way that you're comfortable with as a professional and that the patient and partner are comfortable with as well. So important to bring in not only the patient, but the partner and looking at what their concerns are. Oftentimes, though, we have people with significant medical issues that are physically impacting sexual function. The partner is saying, gee, it's my fault. It's my fault because I'm no longer attractive enough, or I don't turn my partner on. And that's, I guess, occasionally, but very, very rarely the case. So bring in people who act as consultants. Certainly make sure that there's a a medical physician, a cardiologist, a nutritionist, a physical therapist who can address aches and pains. Sometimes we use personal trainers, mental health colleagues for both couples issues and personal issues are so very important. Remember, it is one of the most satisfying aspects of urology that I practice, and I don't know of anywhere else where a multitude of skills are required. Because remember that we're using intervention to improve their physical and mental health. Sometimes we're using pills, sometimes we're using hormones and vacuum devices, even injections of medication into the corporal bodies or the vascular areas of the penis that engorge for a firm, hard erection. And of course, penile implants, which, and done in the correct population, is just an impressively fascinating opportunity to make a difference in the patient who really needs it. This is fun. It's exciting. It's never boring. Remember the days of taking this pill and having your patient call you if they get an erection for more than 4 hours. That day is history. Have fun. Learn about sexual health.